this week was 378, and that is a 66% increase from the prior week. Newsy National Correspondent Terace Garnier reporting on the latest COVID numbers and recommendations. So, Terace, give us some more detail and some more context about these rising pediatric cases.
Well, Rob, this Omicron surge is sending COVID-19 cases skyrocketing, and it's putting children in the hospital at record numbers. But children do continue to represent a small percentage of those being hospitalized with COVID-19.
And it's getting so bad, in fact, the military right now has had to deploy more troops to help even more hospitals across the country. We've seen this in multiple states and multiple times during the last 2 years. So where is the need the greatest right now that we're in a situation where the National Guard has to come in and lend a helping hand to hospitals that are strained and staffs that are just beyond exhausted?
Well, not only National Guard, but it's also active duty military as well. And so far, 65 military medical personnel will deploy in 4 teams to Arizona, Michigan, and Pennsylvania. Now, as you know, we've reported on this earlier this year. They are going to help civilian healthcare workers treat COVID-19 patients. Now, this already includes teams that were already in Michigan, and then they had 7 teams working in Colorado, Indiana, Minnesota, New Mexico, and Wisconsin. Rob?
Another big headline right now, of course, is the expanding eligibility pool when it comes to shots and to boosters in our country. So we do expect as early as Monday, in fact, for the FDA to sign off, CDC to sign off on those booster shots for teens and preteens. So what are the details about that pending decision?
Well, the Pfizer vaccine is 92% effective at preventing COVID-19 in young people ages 12 to 17. And this is based on a study that they did between July and December in Arizona. So the FDA approved the vaccine for people as young as 16, and it's also available for under emergency authorization use for ages 5 to 15. Rob?
And, of course, can't ignore the big headline of the day. It's New Year's Eve. You know, it's typically a huge party night in our country from coast to coast. What are the health experts saying, though, is the best advice to follow since we are still very much in the middle of this pandemic and in the middle of this surge? How should we celebrate tonight?
Well, I think the best phrase or the best way to put it is the new year is bringing in new fears. Doctors are recommending that people avoid New Year's Eve celebrations, and if they can't, limit the amount of people in small spaces and also make sure that they are socially distancing.
Even if you're just with 4 or 5 individuals, there's a good likelihood that at least one of them could have COVID-19.
In many places, plans for New Year's Eve celebrations have already been canceled for the 2nd year in a row due to a surge in coronavirus infections. So hopefully everyone's going to be safe tonight, and we'll be able to prevent any more spreads for 2022. Rob?
Fingers crossed for that. Basically, the doctor's saying, listen, keep it small and be with those who you know are vaccinated, basically, and hopefully boosted. National Correspondent Terace Garnier with the latest on that front. Thank you, Terace.
Thank you, Rob.
The Omicron surge has school districts right now pretty much scrambling to figure out if kids should or should not return to the classroom after winter break next week. Schools in D.C. and Baltimore are extending winter break, in fact, by 2 days. Here where we are in Atlanta, public schools will start on time, but will require mandatory testing for teachers twice a week. Schools in Connecticut, California, and New York, they are ramping up testing as well. Joining us live from New York City is